And the room is filling up. And we are here, and it's 9 o'clock. My first question for everybody who is here. How you doing? That question's really sincere. So not only to our panelists and those of you who I know, and many of you I do know, but the whole staff, the team and I have been looking at what organizations you represent and who you work for, and what an amazing, powerful collection of talent we have on this call today. It's absolutely amazing. So please know that we like to feel like this is a central plaza. Like here today, we're gathered in a community plaza. It's a beautiful space. We all come here, we put on our gender lenses, and we try and benefit the whole community by seeing more clearly how we can together address inequities and support women and girls for the benefit of all. Our mission at Women's Fund Miami-Dade is to focus on what we need to notice. And today, that is the emotional and mental health of girls and women. And we're going to do it today across age groups. And then we're going to look at what we can do to be supporting them, especially during these intensely challenging times of the pandemic. So welcome, welcome, welcome. I'd like you to now join me in thanking the sponsor of this series, the Miami Dolphins Football Unites, and others of you who especially are gathered here today who deserve some special recognition. We have fabulous board members, amazing interns, 6 of them, 6 amazing interns. Our staff, Carolina and Viviana, busy working here behind the scenes. Feel free to say hi to them in the chat if you'd like. We also have representatives from the offices of Congresswoman Donna Shalala, Senator Marco Rubio, Commissioner Eileen Higgins, the Miami-Dade Commission for Women, the Honorable Cindy Lerner, and not only our State Attorney's Office and Department of Justice, but also from the Attorney General of Mississippi, and attendees from as far away as Nebraska and North Dakota. We welcome you, each and all. So truth be told, the old adage, no money, no mission, is a reality. So we extend our sincere thanks to our grantors, our major donors, and every single grassroots contributor. Each of you are investing in your belief in our organization, and that when women are strong, the world is stronger. So this is a very incomplete, but important shout out, especially to the dedicated professionals who are supporting our young people during the pandemic. Really, really important. And a special shout out to our school board member, Dr. Dorothy Bendros-Mindingal, and her organization, No More Broken Hearts. Many of you have seen this campaign of our public awareness campaigns, one of the many important public awareness campaigns that we've been honored to be able to sponsor with the support of other organizations. Special shout out today to one of those, NAMI Miami, not only for your ongoing support of the Women's Fund Miami-Dade, like with that campaign, but also for your insights on today's program and for all you do for our community every day. I know you've been very important in my life, and I thank you. Now on to our keynote. It's my privilege to introduce one of Miami's great leaders, a NAMI board member, Dr. Patricia Ares Romero, Chief Medical Officer of Jackson Health System's Behavioral Health Hospital, known to many as Dr. Patty. Dr. Patty, welcome.
Thank you. Thank you so much. It's really my honor to be with all of you today and to be part of this distinguished panel as well. So thank you. Thank you. You know, we have experienced the biggest lockdown in our lifetime, changing our everyday behavior, wearing masks, physically distancing, distance learning, and having to work virtually. Some in our community became sick and recovered. Some lives have been lost. Some have lost their jobs and finances have been hit very hard. Practices have transitioned to telephone and telehealth platforms, and education and training has shifted in order for us to stay safe. Our daily mantra has consisted of being flexible, having perseverance, and building on resilience. The increase in mental health concerns are occurring, And these include increased stress, anxiety, depression, increase in domestic violence, substance use, suicide, and the consequences of being unemployed. Never has mental health and mental wellness been more important than it is right now. Who would have imagined that just 1 year ago, how our lives would have changed because of the virus? Thanks to COVID-19, many women have lost their jobs, their health insurance. Many are struggling while homeschooling their children and trying to juggle their jobs. There has never been anything in our lifetime that has affected women as much as this pandemic has. So what are we seeing in our women? We're seeing this loneliness, this depression. Alcohol use has been on the rise, and domestic violence because people have been kept home. So what can we do about it? Pandemics are stressful, they're difficult, and especially when we're isolated and withdrawn. The first and foremost thing we need to understand is the situations that cause us the most stress and affect our well-being. And we need to acknowledge these feelings. And whenever possible, be able to cut out those things that add more stress to our lives. And always try to focus on the things that we can control. Stress can only affect us if we allow it to and we perceive it as such. And also, do what makes you feel safe. Don't take any additional risks if you don't have to. If you feel safe keeping your children at home, do so. If you feel okay with sending them, then that's your choice. It doesn't matter what others are telling you. You as a woman have the right to make that decision, what makes you safe for your family and for you. Self-care is very important. Us as women, we always put ourselves in the back seat, right? We take care of our families, our friends, our jobs, but we don't think about ourselves. So we need to keep ourselves healthy in order to have our families healthy. And so what do we need to do? We need to get enough sleep. We need to start eating healthy. I like to say taking time out. That's my biggest thing, right? So this is a time where even if it's 5 or 10 minutes throughout the day, it's your time to relax and recharge. For me personally, it's that first thing in the morning, having my coffee in silence. If I don't have that, my day just goes to hell, right? So we need to do that. We can practice things such as breathing exercises, visualization techniques, and mindfulness. And all these things are able, there's so much content out in the social media where you can do these things for free. And mindfulness, and I know a lot of times my clients and my patients tell me, I'm not going to sit cross-legged on the floor. That's not what mindfulness is necessarily. It's going for a walk and really feeling the bottom of your feet on the pavement, watching and listening for the birds and being in the present moment. Because when we are in the present moment, we cannot have anxiety or sadness or overwhelm, right? Because when we are in the future, that's what creates our anxiety, worrying about what ifs. Or when we're in the past, then the overwhelm and what I should have done and shouldn't have done. And so we can at least practice mindfulness a couple of times during the day, can be very helpful. Staying active is very important, 20 to 30 minutes is what's recommended. And in reality, if you just take a brisk walk, take a deep breath, relaxes your muscles right after a very stressful situation, it really puts you back, and cuts that stress from you. And, you can practice other things like yoga and Tai Chi, which is always great for bringing us into balance. But above that, we need to have the social connections. We need to stay connected with other ones. At the end of the day, we're social beings, and we need to nourish these positive relationships and be there for each other. That's the only way we're going to get out of this. And in fact, social connections have been proven to increase health and longevity. So it's good for our health and for our lifestyle. And lastly, always try to practice gratitude. And I always say, look for the good in the day, right? Even if it's just one thing, that will help us so much to just look for that one thing. And if we're having a bad day, and I know I have bad days, if it's just waking up and saying, you know what, I am so thankful that I'm up today and I am breathing, or that I'm able to go for a walk. Look for that one thing in the day. And finally, I wouldn't be remiss if resiliency. And these are just really the pillars of it, and these are things that we can work on. It's really a life strategy that helps us to cope and survive with the bad times. So practicing mindfulness, working on our emotional regulation, because really that prevents us from getting into that real downward spiral. Strong relationships, having flexibility, and that's part of it. Working on our positive coping strategies and working on self-esteem, which is so needed for all of us, especially during these times. Next slide. And of course, mental health is a serious thing. And if you or someone you know is suffering from any kind of behavioral, emotional, substance-related issues, please seek help. Please tell them that there are resources out there. The 211 information referrals line is excellent. It's a crisis line. We have www.thrivingmind.org. They're the managing entity for our community. So if someone you know is, has lost their health insurance or are underinsured, there's a wonderful resources on there for the entire community. The suicide prevention line is always something that we should keep in mind. And Jackson Behavioral Health Hospital, where I work, this is the referral line if you need assessment and referral to a therapist or psychologist or a psychiatrist. And of course, I would be remiss without mentioning NAMI, Miami.org, and a lot of resources. We have groups going on virtually to help everyone in our community. So please go online and check it out. So this is just a thought. Every experience, no matter how bad it seems, holds within it some blessings of some kind. The goal is to find it. And that's really what we need to be doing during this time, looking for the good in it. Thank you so much. And this is the way my email, if you want to reach out to me, I'll be more than happy to talk to you.
Thank you so much, Dr. Patty. And thank you so much for keeping it real. It's fantastic that not only are you keynoting for us today, but that you'll be joining the other panelists at the end in the Q&A. And I know people are really curious to find out what you're seeing. We're not going to violate any HIPAA regulations with any of you today, but we do want a general idea of what you're seeing and what our community members are experiencing. So we thank you so much for staying for that Q&A later. So how's this webinar going to work? We're going to be launching 3 polls during this webinar, and we ask you to fully engage and participate. Here goes number 1. The Q&A. Yes, we are going to have Q&A at the end. It is a very important part of this webinar, and it's only important as your questions. So please do post them in that Q&A tab, and I'll get to as many as I possibly can. In the past, many of you have seen us ask you to add 3 of your own issues and challenges that you're finding as regards the topic, and 3 large or small solutions that you suggest. Instead of doing that now during the webinar, we're doing that in our post-exit survey. The second that this webinar is over, you will get a survey in your inbox. Please just take a couple minutes. It will be fast, and we're using that information. Your Women's Fund is doing all kinds of exciting things, and when you participate, you're going to see results. We're measuring, we're using your feedback, so please, this is not superficial. We mean it. So on we go. This approach, which is kind of interesting, that we're going to go generationally, and although each of our panelists has expertise in many areas, we're going to go through the ages. We're going to start first with Sandy Skelaney, and we're going to ask Sandy and each of our panelists to introduce themselves just for a quick 2 minutes, just in context of today's topic. Each of them could do a webinar of their own, but we'll start with you now, Sandy. Thank you for being here.
Oh, thank you so much. And that was a wonderful talk, Dr. Ares Romero. So I'm Sandy Skelaney. I'm the Executive Director of Mindful Kids Miami. And we bring the benefits of mindfulness to children throughout Miami and South Florida. And we do this primarily through the adults that interact with them daily. So by providing workshops and mindfulness programs to the teachers, social workers, parents, and other adults in our community. We also provide workshops and programs specifically for children and teenagers as well. In addition to doing that, I'm also an adjunct professor at FIU in the Center for Women and Gender Studies, where I teach sex trafficking building solutions. And prior to this job that I have now, I've spent 15 years building multidisciplinary responses to child sex trafficking. I founded the Project Gold at Christie House in 2007, and I've worked with or managed the advocacy and mental health care for hundreds of girls and teens who are survivors of sex trafficking here in Miami. So thank you so much for having me.
Thank you for all you've done and continue to do for our community. Suzy, welcome, welcome.
Good morning. I'm Suzy Schumer, and I am the CEO of Institute for Child and Family Health. We are a nonprofit organization that has been around since 1945. This year, we are celebrating our 75th year, and we focus on programming that empower the children, youth, and now adults, which I'll talk about later, and families in our community by providing services that enhance emotional and physical and educational well-being. And I'll talk later in solutions about more of the services we provide. I'm born and raised in Miami. I graduated from Barry University with my master's in social work many years ago with a focus in mental health. So when I was asked to be a part of this panel, I was so happy. I believe in the importance of everybody being able to live the life that they want and that they deserve. And everything that Dr. Patty talked about is exactly what we're seeing at ICFH work, and I'll talk more about that related to adolescence. I have a great passion for my work, and many people suffer in silence. So I'm so happy that this is the focus of the panel today, especially in these times with the pandemic, because we see the challenges and the symptoms being exacerbated by being home, and with depression and anxiety and increased substance use and increased domestic violence. There's a lot of work to be done. I'm very happy to be here among the wonderful panelists and look forward to today. Thank you.
It's amazing, Suzy. We always say, don't be scared, be prepared. These things are going to cross our paths, but there's always something you can do about it. So each of you being here today is amazing. And I was going to formally introduce Dr. LaTasha Russell, but she says, call me Dr. Tasha. So go, Dr. Tasha, all yours.
Thank you so much. So I'm representing kind of two, the Association of Black Psychologists and then my private practice, which is Drive-By Therapy. With the Association of Black Psychologists, we do a lot of different things, especially during this year of course, the social injustice that was just exacerbated, I would say, from a lot of different deaths just this summer while we were home watching TV and seeing different images, obviously, that were quite disturbing. We've also done grief tributes, like different workshops. A lot of times that is something that we don't talk about in our community and society, is death and how to manage it, because grief, obviously, every time that we are turning on anything when it comes to media is kind of like hitting us in the face. And a lot of times we haven't been taught. We do healing circles, which I have found, you would think to yourself, it's so nice to be in a circle, but even through Zoom, it actually works, for people to feel heard and acknowledged. When it comes to Drive-By Therapy, which is my private practice, I work with men, women, boys, as well as girls, but what I think is the best and the most rewarding is when we do like the family interventions. And a lot of times there's that mother-daughter dynamic that we know does not go away from when we are the teenager to when we are 30 years old and our mothers are maybe 50, or when we're 50 years old and our mother is 70. And there's a lot of unresolved childhood issues that sometimes we don't talk about. And I'm always wanting to give permission to women as well as girls, is that you don't have to be fine. That's what we do every day. And we say, how are you doing? Everything's fine. No, it's not. And I'm giving you permission to actually acknowledge that. And so we'll talk about a lot more later in terms of other things and issues that I've seen during the pandemic. But thank you again for having me.
Thank you. Thank you. Chrystine, I'm going to thank Dr. Jenny Dries from UM for introducing us to you and your work. Thank you so much for being here. Please introduce yourself in context.
Sure. My name is Chrystine Kopcsik, and I really want to thank the Women's Fund today for this opportunity. I'm a licensed clinical social worker, and I have been I think it's 20 years this year, and in different settings, nursing home, assisted living, mental health, dialysis, medical settings, and currently at the Mind Institute at Miami Jewish Health. And we are a Department of Elder Affairs memory disorder clinic. And so what we do is evaluate persons for neurocognitive disorders like Alzheimer's, any other type of dementia. And I work primarily with clients and with caregivers for support services and also for brain fitness. And our field in social work is a helping field. And so we're looking not just at the now, We want to help people get the resources that they need now, but also for the future to build upon their strengths. And that's really what our field is all about. And through most of my career, I've worked with clients and caregivers who are seniors and who are predominantly women. So this has been my population for a long time. And women consistently live longer, and we predominantly are the group that provides caregiving services to others, children, seniors in the family, and also as a profession of caregiving as well. And so according to the UN Women's statistics right now, during the COVID pandemic right now, 70% of the persons that are providing care for health, medical, and supportive care around the world are women. Doctors, nurses, social workers, everything all the way to housekeeping and food service workers. And so I'm going to say that again, 70% worldwide during this pandemic, providing care, frontline workers are women. And clearly, we are needed and we are critical in this crisis. And we're doing life-saving work. So I thank you again for this opportunity and really appreciate it.
What a rich, rich panel we have today. Thank you so much. We're going to go now into those challenges, especially what are you all seeing right here, right now? In about 3 minutes, can you just give a summarize of current challenges? And we'll start with you, Sandy.
Hey, hi. So, I think that a lot of us are going to say similar things on our bullet point list of challenges, right? So this situation is impacting mental health negatively. It's increasing stress significantly, depression, anxiety, and loneliness. It also, for children, increases vulnerability to parental angst, family conflict, and physical and sexual abuse as well. And while it's increasing those vulnerabilities, it's also decreasing access to supportive services and helping adults. So children don't have as much access to their social workers if they're doing telemedicine visits or televisits with social workers, or even doing Zoom schooling. They don't really have an opportunity to be able to make those transformational and supportive relationships work for them. And so, the result of that is that they would be probably less likely to disclose abuse and what their needs are inside the home. Also, there's long-term impacts of this. So there, a meta-analysis of 63 studies that included 51,000 participants showed that social isolation and loneliness actually increase risk of depression 9 years later. So this isn't just an acute issue that we're working through, kind of how do we get through depression this year. If we are in a state of isolation for this year, this can possibly impact us 9 years from now. So what are we seeing in our organization? We provide, mindfulness-based stress reduction programs and also teacher training programs to help teachers and social workers learn how to bring these practices to the kids they work with. And we are seeing right now an increase in a lot of demand for what we have to offer, but at the same time, so much stress and conflict about, how do we have the time to fit these programs in. We have all of our programs online now, but we have an increase in number of ELCC, which is the Early Learning Career Center and the Early Learning Coalition groups. So all of these organizations and centers that are caretaking younger kids pre-kindergarten, they are getting on board. They're getting their staff trained in mindfulness so that they can better deal with the stress that they have in being caretakers for these children, in addition to helping these children manage their emotional reactions in this time. So we're definitely seeing more engagement in that area, which is really wonderful. We have, of course, there's a number of studies that have been done on thousands of children throughout the world, China, Bangladesh, Italy, and Spain during COVID particularly. And so I think it's worth noting that, we have 86% of parents report changes in emotion and behavior with children. So we're seeing that this is really, really impacting the kids. 77% of the kids are having difficulty concentrating. 30 to 40% report irritability, restlessness, nervousness, loneliness, uneasiness, and worry. We have 22% in one study in China said that there was 22% of the participants with clinical depression symptoms, which was up from 13% estimate. And there were other studies that showed 44% of the children had depressive symptoms and 37% had anxiety. And in that study, they found that girls had higher rates of depression. So clearly this is an issue for children that we need to be focusing on.
So important, so important. Thank you. Suzy, we know that you work with many ages, but you're gonna speak to us about teenagers particularly today and what your staff is seeing.
Yes, and I remember what it was like to be a teenage girl, and we know that it's not easy. And now with the pandemic, as I said earlier, many things have been exacerbated. There are many factors that determine mental health outcomes. And the more risk factors an adolescent girl has, the greater impact on their mental health. And risk factors for most adolescent girls include technology and social media, something that I didn't have when I was younger, and the impact on what they're seeing in social media and how it impacts their self-esteem and their body image. Individuals that want greater autonomy, peer pressure, and the quality of home life and the relationship with their peers. And what we're seeing at ICFH are those risk factors along with others. We have many families that come from single parent homes, families with immigration issues, therefore they're sometimes afraid to seek help, parents with very low level education, many parents and grandparents that don't speak English, and increased domestic violence and substance use. And when the pandemic hit, there were some parents that worked out of the home, and now all of a sudden everybody was in the house together. The kids weren't going to school and the parents were home. That created a lot of additional challenges that exacerbated the challenges that already existed. So everything that Dr. Romero said earlier is exactly what we're seeing. Increased depression, increased anxiety, increased domestic violence, increased substance use, isolation. So the fact that our teen girls can't be with their friends, it has been very challenging for them. Also, many of our clients are behind academically, and they didn't necessarily have the technology, even with getting the tablet or the computer from the school, they didn't have internet. So we have done a lot of extra assistance to get everybody up and running to be able to have therapy and to be able to participate in school. One of the other challenges we saw is as the parents started to go back to work and some of our teens were home with their grandparents who didn't speak English and couldn't provide the level of monitoring the kids need, the kids were just logging off and weren't getting their education. So we are grateful to be able to continue to be of support to our clients at this time. The other factor too, as therapists, we always talk about self-care for ourselves because we can be exposed to secondary traumatic stress and it's hard for us. And now because the therapists are personally going through many things with their families and health issues and the anxiety and the isolation, we're doing our best to take care of our staff to make sure that they can continue to take care of our clients.
So important. So many people who are in the audience today are attending or participating from home. A lot of service providers, I think, are nodding their heads at the same time with self-care, and it's an intense time. Thank you so much, Suzy. Dr. Tasha, what are you seeing?
Oh boy. So to be honest, I'm already anticipating that someone's going to call this week for election fatigue. That's already going to be happening soon this week. But it's interesting when Dr. Patty and Suzy were speaking about domestic violence going up. It's true, but there's something that we don't talk about as much, and that is that women many times are the aggressor. And it's not just always the, he's doing this to me, or if it was a same-sex marriage, that she's doing this to me. But it's just the idea that women are also struggling with their own anger management. And possibly even the addiction that we spoke about, the alcoholism, or even what I've even seen is a lot of self-harm, a lot of self-destructive behaviors are happening. And the way that I think of addiction, a lot of times is obviously to cope or to numb with the feelings that are really going on. It's true that in the household, just like the teenager is kind of up to here, so are the moms or the wives that are.
Oh, there you're back. Dr. Tasha, we missed you for the last couple of minutes.
Oh, really? Oh, no.
No, maybe it was mine. I will be quiet and let you continue. Must have been mine.
No, it's okay. I didn't know. I don't know what to say. Okay, we'll see what you guys did here. The idea is of addiction, obviously, is to numb the actual feelings that are going on, or to distract yourself from actually acknowledging that you are having feelings. So I wanted to talk about something that in terms of addictions like shopping. A lot of times we say to put the bottle down, but no one's saying to put the phone down, where all the Amazon boxes that are coming. And again, it's just a distraction. It seems small, but it actually isn't when we get in debt, and then we're more depressed than when we started the pandemic in the beginning. In our household, a lot of people are irritated, annoyed, and frustrated. And that goes from the dog all the way up to possibly grandma, And so could you imagine if everybody is in the home, it only makes sense that there are a lot of feelings that are being kind of, let's say, externalized onto each other or projected onto each other, that I've been telling a lot of people to work on the thank yous and the I'm sorries. It seems very small, but a lot of times it's just a matter of just acknowledging that you're not the only one that is anxious, and you're not the only one that is depressed. There was another thing I was going to say. It was interesting when Suzy talked about the teenagers. Women are also comparing themselves to all the TikTok videos, and man, I wish my family was this way, and I wish we knew how to dance this way. You know what I mean? I mean, it's very cute, but just know that every family is not that way. And you don't know how many takes they had before they had that, the one great finale that we're seeing on the social media. And so I have been talking to a lot of women about taking pride in your own home. And what it is that you have versus always thinking about what you don't have. And lastly, there's another thing that I'm finding are a lot of career-oriented women in the last year are realizing how they put their career over friendships or even relationships, romantic relationships, where they're sometimes also miserable right now because they were making sure they got this degree and this certification and all of that. But then they're also during this time, they're like, oh man, I possibly has spent more time going up the ladder versus like nurturing great relationships.
So powerful, so powerful. Thank you. Chrystine, I understand that there was a special task force put together at Miami Jewish to work with seniors who are really undergoing a lot of duress at these times. Can you tell us what you're seeing?
Well, at this point, it's kind of starting with just in general, seniors and anyone over 65. 9% of the US population, and that's 29,277,000 people, are female seniors. In state of Florida, 11% of the population are female seniors. So it's a pretty large group. And I think the first thing that obviously comes to mind and everyone really has paid attention to is the physical dangers and all of those things that, jump right out. The seniors are the most vulnerable population and the most marginalized during the time of all the isolation. And unfortunately, there's so many other things besides the physical dangers. It's the mental health and the emotional health issues. And so one way I think to kind of explain what we're hearing, I'm going to give you kind of some of the comments that I've been hearing from residents and from clients and from caregivers in the last 7 months. And gives you a pretty clear picture. So I can't do anything I used to do. I just miss getting together with my friends. We talk on the phone, but it's not the same. The days are endless. I'm so tired all the time. No one can tell us when this is going to end. The facts change all the time. We don't really know what's happening. How long can this go on? It's just the worst. Every day is running together. I don't know if I'm coming or I'm going. I don't feel like myself anymore. I used to be interested in things and I just don't care anymore. I just don't care that much. I'm afraid of getting this virus and I've lost 3 friends already and I don't want to get it. I don't want to die from it. And I'm worried about my daughter. She's working from home. She's a single mother. She's trying to help with the kids and school. And now she has me full time. And this is a patient that used to be in an adult day program. And so she had services and socialization and support, and she's home now. And so, feeling bad that she's an extra burden she feels. So I'm in caregivers, it's so hard to reach the doctor, but God, I hope I don't have to go into the office. I'm so stressed. I'm so tired. This is exhausting and there's no end in sight. And, noticing, I feel like my mom is just, she's going down. She's more confused. She's sleeping. Her memory is bad. It's just getting worse. And just the fear themselves, caregivers. So I'm afraid I'm going to get it. We're trying to be careful, but I work in healthcare. I'm afraid of exposing my mom, exposing my kids. And we're just trying to be so careful, but I'm always worried. And so, it's just so many different emotions that we're seeing right now. Reduced access to medical care and support services like adult daycare for seniors. Isolation, lack of socialization, stimulation, loss of daily routine, loss of structure, and loss of purpose. And all of these have led to worsening medical conditions and increased mental health issues, boredom, apathy, loneliness, depression, anxiety, fear, grief, all of those. And then worsening cognitive decline, no socialization, no stimulation, which for our population is particularly bad because someone who already has cognitive issues needs that socialization, needs that stimulation. If they don't get it, they're really showing decline quicker than maybe they would have. And the issue primarily for caregivers that we're seeing is just a new height in caregiver burnout and just caregiver stress. They're mostly women who are family caregivers. They're maybe working from home and at the same time, they're providing more care now to the children, helping with school, more care for seniors. And for those who aren't working at home, they're afraid, of the exposure that they're getting and what would happen if, I'm sick, everybody's depending on me and I got to be healthy. So, those are all the types of things that I'm seeing right now. And, the task force that we have at our facility has been a great collaboration because we really have a network of, call in anything that's going on. Someone can call in and speak to one of us, be it the psychologist, me, social worker, and also within the nursing home. And we're a large organization and we have full continuity of care. So it's a large group of people. And one of the things that we've done, one of the things that I get to do that I love is I do brain fitness on campus. It's on our internal television station. And so we do that a couple of times a week. And I do one program that's a little, maybe catering to a little bit lower functioning and then one catering to a little bit higher functioning.
That's so great. Those are solutions that we're so looking forward to.
Yeah,
we need those fun. Solutions. And we're going to do that in this next round.
Sure.
I want to mention, Chrystine, that the Women's Fund is really interested in the data that you're all collecting. We're really interested in seeing what's happening to people. And so I understand from Dr. Dreiss and from you all working in the task force that a lot of that data just didn't exist before. We haven't been in a pandemic. Mm-hmm. And so I think collectively, I want to share with this huge group of people who are with us today and who will be seeing the webinar later, that we need to not only be recognizing what's happening, looking for the solutions for now, but also gathering whatever data that we can in preparation for issues to come. Once again, don't be scared. be prepared. And everybody here today is very well positioned to help with that. So this exciting portion, the part that's a relief for us all, what solutions are you seeing and what do you have to offer? Sandy, please take it away.
All right. So, I see these solutions kind of in two groupings. And one is, the things you have control over, and then there's the things you don't have control over. And that's really about the shift in perspective. So just tangibly, we need to put our own masks on, no pun intended. But, we need to do that first. If our intention is to help our children, we need to take care of ourselves first. And so we mentioned self-care, and, we know that this is really important. But 75% or more of parents are stressed right now, and parental stress directly correlates with children's emotional and behavioral health. So we need to understand that us being stressed about this situation is not helpful, and it's going to make things worse for our kids. So if that's what is happening, then parents and teachers and people that are caring for children, and we need to actually get help if we need it. Call the 211 number for referrals, and really kind of take stock of where you're at personally. But then also talk to kids about COVID and their feelings around it. So some of these studies have shown that just the fact that they don't know, they're not kind of in on what's being talked about, and not a part of that conversation, and their feelings aren't being acknowledged, that creates more stress, more anxiety, more depression with children. And so really kind of bringing them into the loop with that. Understanding where to get help for your kids, have them assessed if you feel like that, their emotional and mental health is declining. Spend more time outside. We keep hearing this stuff, but I can't tell you how amazing it is and how much of a change it made in my own personal kind of feelings of well-being just to go outside for a walk every day. Every single day I got outside. If I was if I'm in an energetic mood, I'll run. But even if I'm really tired, I at least walk. It's also boosted my vitamin D levels, according to my lab work, which increases immunity and all of those other wonderful things, right? And really taking stock of kind of your own health and building that physical health resilience, working out, and all of those things all make a difference. And then providing more knowledge about awareness and prevention of COVID. So some of these studies also said that the kids that didn't have depressive symptoms in these studies also had more knowledge about COVID and how to prevent it. And so there's that link between the feeling of control and the feeling of I can do something about this, and not feeling those anxiety symptoms, right? And so that brings me to kind of what we're all about, right? Which is mindfulness. And so uncertainty is a tremendous stress producer. Like that is kind of what we're looking at here. We're living in uncertainty. We have no idea how long this is going to last. There's this invisible germ out there. We don't know if we're going to catch it by, opening the bags that get delivered, from the store. And I think that, this triggers our trauma responses, or, our fight or flight mechanisms. We try to control things around us to kind of alleviate those feelings of discomfort. We end up really, the more we try to fight that, the more that we try to control the situation, the more we produce suffering for ourselves, right? So there's the pain that exists, and then there's the story that we tell ourselves about the pain, and that is our suffering, right? So you can have pain, but you don't have to suffer from that pain. So, and the trick to doing that, the trick to not kind of having this lingering, ongoing suffering, is really bringing mindfulness into your life and having a clear understanding of what is that pain? What does it look like? What are the, what are the boundaries of that pain? And being present in that moment. And so that's kind of, a kind of illustration of that would be if you're standing in the middle of a storm, right? Are you able to be present in the storm and say, okay, there's clouds over my head, it's raining, I feel, you know, wet right now, but I know that the sun is behind the clouds. I know that this is changing minute to minute that I'm standing here. I can feel it changing, and that it's not going to be forever. And that's kind of like your real-time present experience if you're focused on that present experience. Or is the story you're saying, my clothes are going to be wet all day, you know, it's only clouds, it's clouds forever, it's rain forever, the storm is, you know, is terrible, it's ruining everything. Okay, so that's the suffering, right? And so really figuring out and practicing a way to separate that so that you don't catastrophize everything that's happening. And that's really about developing a mindfulness practice, right? And so mindfulness is the act of paying attention in the present moment, non-judgmentally. And, you know, like it was mentioned before, you can do that in so many different ways. You know, you can have formal meditation practices. You can do it through physical things like yoga or walking or Tai Chi. You can just have mindfulness in your eating, you know. Are we just kind of like compulsively eating comfort food nonstop and getting into the cycle of gaining weight and then feeling shame and then, you know, escaping into addictions of shopping and everything, you know, other things just to kind of avoid that discomfort of feeling that shame, you know. So there's like the cyclical thing that's happening. And if we're kind of mindful about what am I consuming right now? What am I feeling right now when I'm interacting with my child? What's my internal experience at this moment when I'm talking to this child, right? All of that will improve not only our mental health, but the mental health of the kids around that we're interacting with, the kids that we live with, the kids that we're caring for. For teachers, that is so important. You know, the teachers that we've been working with, they've just been giving us these reports, just how stressed they are. And they have to take care of all these kids remotely. You know, they don't have a chance to even get to know them really. You know, they can't tell if they're kind of crying on the other end of that Zoom call or, you know, what their status is. And they're so stressed about helping the kids that they're supposed to help in school. Then they are also taking care of their own children at home. There's so much going on. And then taking care of, you know, special needs children at home that if you've never had to do that before, like as far as educationally, you know, so there's so much. And you can see they're just kind of, people are desperate. They're like, I need these programs. I need this so much right now. And so mindfulness, you know, the benefits of mindfulness, hundreds of studies have been done about this. It decreases depression, decreases anxiety, decreases stress, decreases burnout on the, you know, it decreases even felt chronic pain. So if you're having pain in your body, it will decrease that. It improves your sleep, it improves your focus, it improves your memory, all great. It increases your sense of connection, improves your relationships around you, and it improves your sense of well-being in general. And numerous studies have even gone on been done with MRIs. And they have shown that practicing mindfulness actually shrinks the gray matter in your brain around the amygdala, which is firing off those, you know, signals to respond with trauma responses, the fight or flight, and stress responses. And so, you know, even biologically, it impacts you and helps you reduce your stress and deal with your emotional like environment, right? So you can manage your emotions better. So we have the Mindful Kids Miami. The name is a misnomer because we do have programs and series, workshops and series for children, but our strategy is that we don't think that just a one-off workshop with a kid is necessarily going to create these long-term impacts for them when they're going back to environments that aren't mindful. And so what our goal is to create culture of mindfulness around children. And so that's why we're specifically targeting teachers, schools, early learning centers, and different organizations, especially organizations that are working with children and people who have experienced trauma. For example, we're working with doing mindfulness trainings for the staff of Lotus House right now. So, you know, we're available for you. All of our programs are on our website, mindfulkidsmiami.org, and we also have made it available with scholarships, and we want to be able to make sure that we're reaching everybody that needs it, even if there are financial difficulties and things like that. So.
Make sure, Sandy, and post all your contacts in our chat as well. We want to make sure that everybody can access all this information. Suzy, really interested to hear what tools you are all offering to teens. Please take it away.
Thank you. I just want to go back for a minute when I was talking earlier about what we're seeing. I talked about all of the risk factors. I also want to highlight all of the positive things that we're seeing. The resilience, the flexibility, the strength of our staff and our clients. We had not done telehealth at ICFH. We transitioned within a couple of days, and to train our staff and to get the clients on, and we did it, and we're still going, and I'm so proud of that. We provide services. Historically, we've been an organization that has provided services to children, adolescents, and families. We decided in May to start providing therapy for adults, which is something we had not done at ICFH, to try to have a greater impact because there was such a need in our community. And we have consistently been getting referrals for adults with very significant mental health challenges and substance use. So we're very happy to be providing that service. We provide individual therapy, family therapy, because like Sandy said, if we work only with the teenage girl, the adolescent, the young child, the adult, without working with the family, it's very hard for real, true progress to happen. So I'm very grateful that we have many families where the parents do participate in family therapy, because that, I believe, is the key to success for our teens. We provide psychiatric services, crisis intervention. We also have a school-based substance abuse prevention program in some of Miami-Dade County and Broward County schools. We're very proud of that model. And I just remembered, as this panel was going on, our supervisor for our Miami-Dade prevention program is going to be doing a parent workshop in December called Managing Anxiety and Boosting Family Resilience in Uncertain Times. So if anyone who is watching is interested, you can reach out to me, you can call or email me, and I'm more than happy to get the information to you. And also removing the barrier to access to care. That is so important, because many of our families don't know who to call, don't know where to go. So all of the resources that have been provided today are so important that you have people to call, that we will guide and help you if you're unable to find the help that you're looking for. And I truly believe that therapy can be such a wonderful thing. It's not an easy process. However, if you find a good therapist, it can really help the teens, the parents, the kids to get better and to continue to get through this time with or without the pandemic. It is very hard for our teenage girls. And if anyone who's watching knows someone or is having challenges themselves and are afraid to reach out, take that step. It can really, really be worth it. And this information is for our referral department, and our office is the 305-274 number. I'm extension 1020. If you'd like to reach out to me, I take all my calls. So if you'd like to call and ask questions about where to get help, I'm more than happy to assist. Our services are, we take almost all of the Medicaid HMOs. We also have funding through Thriving Mind that Dr. Romero talked about earlier, for children that do not have any health insurance. So they can still get services. We also have grant funded programs. We have parenting programs for parents of young children that are all fully funded. by other funders and are free of charge to the parents. Thank you so much again for this opportunity to be here today.
Amazing resources. It's amazing. And people often don't act because they just think expensive. It's really, hopefully we will unfreeze a lot of people today, seeing what's available. Chrystine.
Hey.
Oh, excuse me.
Oh,
Did I miss Dr. Tasha? Excuse me. I saw you, your face was right there. Excuse me, Dr. Tasha first, and then I'll come to you, Chrystine. Excuse me.
It's
No
okay.
problem.
So number one, I like to talk to women about stop using should statements. Should statements get us to that place of almost this catastrophizing, or this level, which can be anxiety, or this level of depression, which kind of is this downward spiral. So all you're thinking every day is what you should be doing, and what you should have done either last week or last year or a decade ago. And so I just want you to try your best to be kind to yourself. That 4-letter word, kind, is not something that you hear often, but if you could start to be kind to yourself and to stop using all these should statements. Now, what does that look like, Dr. Tasha? Okay, your homework is to take a bath. Amazing concept. I mean, literally just lay back, little bubbles. Sometimes you can get them kind of in your favorite fragrance, and literally lay in the bath and enjoy it. Listen to that word, enjoy it. Stop and enjoy a moment with yourself. It sounds so small, kind of like, was it Sandy talking about going outside? And yes, go outside to the sun, but I also want you to take a bath. Not literally like hygiene, but I mean, obviously I want you to take showers and all of that, but I mean to actually enjoy and rest. Here's another one, become a minimalist. Now, I'm not telling you to find a tiny house, but I am telling you to find ways to almost be like grateful for the small things. And it's so funny. I like to say this, and I said this it was maybe about a few months ago, and someone was like, I never thought about that. So the laundry, okay? The laundry is stacked up, in the laundry room or in the closet. And I would like you to start being grateful that there's laundry. The fact that, oh my gosh, I really appreciate that I have clothes to wear. Interesting concept. Or I'm really grateful for the fact that I have a washer and dryer and I don't have to go to the laundromat anymore. Or these kids that are getting on my nerves, these are actually my kids. I'm so glad that I have children, because I know many, many couples that try really hard and are not able to. I have this spouse that is so interestingly, annoying me right now at 10 p.m. However, I am grateful to have a spouse, because there are a lot of other women that are waiting for one, or they are widows and that one, their spouse passed away years ago. So I want you to find ways to be satisfied even in the small things. That's an actual personality type when you're never satisfied, okay? And then let's see, don't minimize your emotions. Oh my God, I cannot stop saying this enough. I want you to acknowledge what's going on, good or bad, because you can't change things that you don't acknowledge. You just can't. So I want you to first give yourself permission to say, oh my gosh, I'm feeling a little salty right now. Where did I become a little salty? Was it earlier this morning? Was it a phone call that I made? And lastly, extroverts and introverts. I want you to verbalize the things that you need. If you're an introvert and you need space, ask for it. I need some space. Now, remember, for those that need you, right? Because everybody needs you. You're literally saying, give me like an hour, give me 30 minutes. You can even teach your children about time. When when this hand gets to the 6, that means that mommy's coming back outside, or you're as a sister or as a wife. Either way it goes, you can ask for what you need. And then for the extroverts, I need to be touched. I need to be talked to, right? Just start to verbalize the things that you need. And it's kind of crazy. You'll actually feel better. Even the person that can actually bring you that level of happiness will feel better as well, to give you that space or to give you that time and touch. All right, I'm giving you permission to feel and to acknowledge it.
Thank you so much, Dr. Tasha. Chrystine.
Wow. Looking at solutions very practically, access to care and services. It's more difficult now to get to your doctor, to get the best care. it's really a big deal to decide if you're actually going to go into a doctor's office or not. And so you really have to weigh the pros and cons. So an absolute necessity now is a smartphone, an iPad, some way that you can visit with family and friends, but also very practically to have your telehealth visits with doctors and with other medical personnel. So it's, it's a necessity. And a lot of seniors do have this type of connection, but there are some that really can't afford it or don't know. And so there's a couple programs for seniors who can't afford their own smartphone, and that is www.safelinkwireless.com or www.assurancewireless.com. And, it's one of the things that I've really actually been uplifting during this time is working with the seniors that we have, and none of them have done telehealth before. And we had the same situation as one of the other panelists. We went up on this in days, and just started. And so I did a lot of practicing with caregivers and practicing with seniors, basically, of how to get on. And, really, they were so timid and worried. And then, they did it. They're a pro now. So, that's one of the things that's an absolute necessity. And so these programs will provide it. And you have to remember that a senior does qualify as an individual household, even if they're living with other family members, because informally, their income, their SSI, their Social Security benefits, those things are in a way paying for room and board. So they do qualify for as individual household to be able to receive those type of services. And another great, fast, easy resource is the ADRC for seniors. ADRC, Aging and Disability Resource Centers. And these are national programs. They're all over the country. The ones that we have locally, the Alliance for Aging in Miami-Dade and the ADRC for Broward is the ADRC for Broward. And these are great programs. You can just Google it and look up, and they have any number of services and questions, anything that you want to know about what services are available. And another really quick resource is the Elder Helpline. And this is part of the Department of Elder Affairs. Very easy to remember, 1-800-96-ELDER. So 1-800-96-ELDER. And there are so many different programs, SNAP or food stamps, home delivery for meals, insurance questions. Right now, we're in the middle of the ability to adjust your insurance for seniors. And so they want to know, what's my best plan? What's my best option? There are programs like EHEAP for emergency home energy assistance to the elderly. SHINE is the one that we're talking about for health insurance evaluation. Even health management services for diabetes, for blood pressure, all of that, depression, legal services, everything. And so you can either go online if you want to, or you can just call in and they'll help you with that. And almost all of the services start with what's called a CARES assessment. And so that CARES assessment is an evaluation that's done. And really you can see how many different programs out there that you don't even know you qualify for. And there's services that provide assistance in the home, assistance with bathing and dressing, assistance with medical and incontinence supplies, any number of services. And we actually have at Miami Jewish Health one great program. We're part of the Florida PACE centers. And the PACE program is a national program. And this is basically program for all-inclusive care for the elderly. And basically their whole job is to keep someone at home who might otherwise be really needing to go into a nursing home or assisted living. And they provide all services, including medical. So it's like a medical HMO, plus everything else that's needed as well is provided. And so that program is very easy. Just call 305-751-PACE, P-A-C-E, 305-751-PACE. And so those are a lot of great resources for seniors. And if you don't take a look and you don't try, you can't access it. So you need to do that. In terms of mental health services, most medical insurances do have a care manager or social worker, especially if someone has a illness like diabetes or high blood pressure or Alzheimer's. They have special care managers that you can call, and you just go through the member services and ask for special assistance and any other services or programs that can be provided through the insurance. And this includes access to mental health or behavioral health as well. And so really at the first sign, it's someone in your family, seniors, loved one with depression or apathy, anything significant mood changes, you want to talk to the primary care physician. And very often you don't need a referral. Sometimes you do need a referral from them, but very often you don't. Sometimes you can just call behavioral health directly. So, you know, we have to access what we already have in terms of services. And for persons without insurance, the community mental health centers, you just search, basically just say community mental health centers near me. And some of them that come up, Douglas Gardens Community Mental Health, Citrus Community Mental Health Services, in Broward, Henderson Behavioral Health. And these, you know, these are great services. So another way to access inexpensive psychotherapy, telehealth care, there's an organization called Open Path Collective. That's all one word, openpathcollective.org. It's affordable care. The sessions cost anywhere from $30 to $60 by telehealth, and it's a national program. In terms of caregiver solutions, medical care, again, for uninsured, if someone doesn't have insurance, definitely the free healthcare centers are what you need to look at. They're free or low cost based on whatever your financial situation is right now. And so basically you just say, find a healthcare center at hrsa.gov. And one easy way to access mental health services if you're working. A lot of people have never tried this, but there's a great program called Employee Assistance Programs. And most organizations have this type of service as part of their benefits. It's confidential. Nobody sees any of that information. And usually they have anywhere from 6 to 12 sessions free. So it's a great service to make use of. And not many people do, actually, which is always surprising. Also, again, medical insurance, whatever you have, behavioral health is also something that's part of that as well. There's a crisis text line, which is great, 24/7 support. You text HOME to 741-741 to reach a crisis counselor 24/7. And also the National Suicide Prevention Lifeline. It's always good to have that one, 1-800-273-8255. And let's see, supportive services. Besides the Department of Elder Affairs helping seniors, they also provide several programs for caregivers as well. And that website for Department of Elder Affairs is www.elderaffairs.org. All one word, elderaffairs.org. And if you're a caregiver of someone with cognitive impairment, dementia, the Alzheimer's Association is fabulous. They have great educational tools, great resources, and that one is very easy, alz.org, very easy to remember. And also memory disorder clinics like we are at Miami Jewish Health. And there are a whole, I think it's about 17 now in the state of Florida. The full listing of MDCs is also on the DOEA website, elderaffairs.org. And lastly, those are kind of practical types of services, but some small but practical solutions for caregivers. I know that several people have talked about this, and this is absolutely true, to take mini breaks. Even if it's 5 minutes at different times, you relieve stress, you come back ready to focus on whatever you need to do. So deep breathing, visualizing your favorite place you want to go, your last vacation, it was wonderful. So practice getting to that relaxed state, even if you have to hide in the bathroom. Just get in there, 5 minutes, that's it. And the more that you do it, the easier it gets to get to that relaxed state quicker. Listen to one or two of your favorite songs or upbeat songs, something that really lifts you up. And everybody has their power songs. So have those ready. Take a 5-minute walk. If you can't leave kids or seniors, take them with you. Or, even if you can, if that's too difficult, just get outside and get some fresh air, just 5 minutes outside, everybody. Do some gentle stretches inside the house. There are so many 5-minute YouTube videos for seated stretches that your seniors can do, your kids can do with you too. And lastly, very easy app. A lot of people I know have this one and I love it. It's called Calm, CALM.com, COM, and it's an app from the App Store. The free version has lots of really brief relaxation tools, and it's really great. Another thing, get support from the family. And so assign chores. Look for things that your kids can do that are simple. So if my child is good at organizing, at the end of the day, they're going to be the one who's going to straighten up the books and the magazines and the loose items out in the front. That's their job. Somebody else will do something else, but they're good at that. I want them to do that. And, it's 5 minutes, 10 minutes, big deal. Don't forget your seniors, because your seniors surprisingly enjoy helping and doing things like that. That sense of purpose and helping is uplifting. And so simple things, use your best judgment. Folding clothes, maybe setting the table, maybe making some simple snacks for the family. Whatever you feel, you have to know your senior, but whatever they can do to help, they love it. And then bargaining for breaks. And this is working with your extended family. So maybe I'm going to cook the meals for, a couple of days for all of us, for both families. And then you're going to do all the laundry and housekeeping. We're trading time. We get a little more time by kind of trading and bargaining with our family. And I guess sometimes we have to bargain with our family. Positive self-talk. So this is a great skill to learn. It's very easy. I think I read one time there's about 100,000 thoughts that come into our mind each day. And the majority of them are negative. It may be this is something evolutionary. It goes back to when we had to worry about everything and, safety and all of that, but it just happens. So when you notice that you're having a negative thought, you're starting to have it, you feel it, stop. Tell yourself stop in your mind. If you can say it out loud, it's even better. But, you don't want to do that all the time. The more that you begin to notice that and respond to it. So respond to it, change the wording, make it less intense. If you change the language, you change the emotion. So if I say, I'm done with this is too much, and I just want to stop, take a breath, I've had enough for today. I'll come back to this tomorrow, and just rewire yourself. The more that you do that, the better you get at it. It becomes a habit, a positive habit. Speak to yourself in the third person. This is very interesting. This is a brain trick. When you use the word I, and we always kind of talk to ourselves in this way of I, and you hear it in your head. But research has shown that talking about yourself as if you're someone else, like a friend that you really care about, tricks the mind into relaxing from strong emotions like stress and anxiety. It just tricks the mind. The mind shuts off from that emotional state and goes into more of a thought processing, a cognitive state. And so, if I'm like, I can't get Mom to take a shower, I'm the worst, what's wrong? Stop, take a breath. Chrystine, it's not critical if she takes a shower today. It'll happen tomorrow. You'll call your sister. She's really good at it. She knows all the tricks. We'll figure it out. So you talk to yourself in your name, and it shuts off that whole process of the escalating emotions. So that's a real easy thing. It takes practice, but again, it's a good positive habit to have.
Thank you, Chrystine. So Maria's going to ask, Maria is going to ask Viviana to launch the next poll, please, as we welcome Dr. Patty back, because this is so rich and it's so amazing that our time is actually flying. And we do have
that's Greg.
Mhm.
And
Yes.
somebody needs to be on mute, I think.
Yeah.
There we go.
Might be your dad.
It's not, it's somebody else's dad. But I want to invite everybody to post in the Q&A, but we do have some questions that have come in on the side. In the last 15 minutes that we have, Dr. Patty's joining us again. We want to make sure that a lot of this rich, resourceful information that you all have been sharing today, please do use the chat to post as much of it as you can. I will say that Jewish Community Services 211 is one of those amazing services. So many providers are affiliated, and it is simple. So when we are under duress and we're a little bit of a deer in the headlights, you think that there's nothing that you can do because you can't remember which of those great resources to go to. Everybody can remember 211, and 211 can get you to resources. So I will go back again. I know, I believe Dr. Patty, you listed 211 or somebody else did before, but 211 is an easy one. There's always something you can do. We know from our panelists today that these issues will cross your path, whether it's a kid, a teenager, an adult, or a senior, but there's always something that we can do. So please don't freeze. Feel empowered to utilize those resources. I am going to bring up a question about resources that we have here. And I'm going to ask Deanne Conley-Graham if you are able to please repost what you posted earlier in the chat. So it's really interesting. Another one of our board members, Gloria Romero Roses, shared some information with us that First Lady Casey DeSantis had announced that about $2 million was going in an emergency grant to address mental health and substance use and abuse disorders in Florida. So that's new and hot off the presses. It's very clear that these issues are happening, and we do have to have support and financial resources. So if Deanne, you can, thank you very much, Deanne. So I'm going to read out loud to focus everybody, because you might be stretching there at home and you might be reading the chat. There's a link to a survey here that we ask you each to not only complete, but also to share. We're trying to get as many people to fill that in as possible. There are new resources that is going to give Miami-Dade County residents access to mental health and wellness services free of charge. And I know from what Deanne was telling us before, that can be extended not only to counseling, but also employment support, et cetera. So please, we are here with resources, and we're stronger together. Remember, we're in the vision, we're in the Central Plaza. All of these experts, whether you're, in front of your computer or if you're on this panel, these resources, when they're shared, they're stronger together, and information is power. So please do everything you can to fill in that survey. And I thank you, Deanne, for offering all of your contact information there for anybody who has questions. Hopefully, many of you represent tens or even hundreds of people in the different organizations that you work with. So please do go ahead and share. I'm going to go then next, Dr. Patty. Can you tell us what you're seeing? Talk about services, because Jackson obviously services a broad swath of our community, and we're so grateful. Can you tell us particularly what you're seeing in these weeks?
So we have a pretty robust emergency room. So we have a standalone psychiatric emergency room in our facility, in our building here in downtown. So we're seeing about 50 to 55 patients a day in the emergency room. Again, it's open 24 hours, so we have a psychiatrist 24/7. But the interesting thing is that our child and adolescent unit, which the census had really gone down during the initial part of COVID, has really spiked up. So we're having an average of about 20 patients child and adolescents admitted. So where it's been severe enough that outpatient services are not working for these patients and they've had to come in. And mainly what we're seeing is suicidal attempts, a lot of anger outbursts where the police has been called for admission. And again, you know, a lot of the children, they don't know how to express how they're feeling. And sometimes that's expressed with irritability, anger, and lashing out. So that's what we're really seeing a lot of. We've also seen a lot of relapse. So perhaps people that had been in recovery are now relapsing again because now they're home. You know, maybe they lost their jobs. Maybe they're just not able to cope with the loneliness. You know, there's a lot of the addiction. I know was mentioned a lot of the panelists before, the trauma, right? So not wanting to deal with that trauma, then we try to numb it with drugs and alcohol. So we're seeing a lot of that. You know, I'm also hearing a lot of people in the community that are just reaching out to me personally and saying, you know, I have a child that's never had any issues and now they're pulling their hair out, right? Or I have a teenager that's refusing to go to school. They don't want to go back. And so parents, I mean, husbands of you know, therapists and friends of mine, they're saying my husband for the first time is having really severe anxiety where he can't leave the house. So we're seeing it. And I think the important thing that we really need to kind of drill down on is that this can happen to anyone. And it doesn't mean that we're weak or that, you know, we're not able to cope. It means that it can affect anyone. And we really need to get past the stigma of mental health and mental illness because, you know, we all need to talk to someone. Right. I heard somebody talking about how in their own, I believe it was Suzy, how they were taking care of their own employees. Right. We had to do that a lot at the beginning as well because our healthcare heroes were here. Right. And they were treating COVID. And so the kids were staying home and the kids were scared. Right. And the parents were scared of going home and giving something to their families. You know, I know I had to strip in the garage right before I walked into my house and you know, took a shower. So it can affect anyone. You know, it's fear. I think, you know, if we look at all of it together, it's just that fear that leads to anxiety and depression and stress and health, right? Because we're on that cortisol driven fight or flight response that I know Sandy was talking about, but it can be toxic, right? So this can be toxic if it's a constant thing. So really, you know, don't be scared. Don't be afraid to ask for help. There's so many resources out there, and please get the help.
We know from some of our other panels that we've had that women are often so busy taking care of others that they're not taking care of themselves first. So we're just going to say that out loud again and again and again. Very funny pun, Sandy, about putting your own mask on first, but that no question is true. So I want to ask each of you to briefly talk about recognizing issues and how names can be confusing. Many of you have brought up domestic violence as an issue that's coming up quite a bit during the pandemic. We at Women's Fund have worked very closely with the State Attorney's Office, the Coordinated Victims Assistance Center, DVSAC, Judge Carol Kelly from the Domestic Violence Court System, because a lot of people weren't calling in, and now people are starting to call in. It's finally getting to the place where people understand that those services are open. But one of the problems that we're finding that people aren't calling is because they hadn't experienced what they would ever call domestic violence before. So intimate partner violence and increased physical aggression. And we know that that can happen in any age category. Can each of you just briefly talk about what signs might be in your different age categories that things are off, even though somebody might not be thinking of domestic violence or child abuse? Sandy, can you start? Mute, sorry.
So, and by my age group, you mean kind of the younger kids? So for, you know, if you're thinking about abuse, you know, you'll see kind of regressive behaviors, bedwetting if they didn't bedwet before, sucking thumbs if they haven't sucked thumbs before. You'll just start seeing kind of changes in behavior, I think. And it might be even hard to kind of just determine whether that's the kind of COVID stress or something more than that. But I think the important thing is that if we're, in constant kind of communication and making sure that kids are connected to, not just isolated with, their parents or one parent, but also just trying to reach out to the kids, connecting with them, even if it's online, because they're just missing so many opportunities for people, for other caretakers in our community to be able to notice these kinds of signs and provide that safe container for them to speak up and say something. And so I think it's on all of us to kind of reach out to proactively be more available to the younger kids that we know in our lives, even if it's remotely.
Thanks so much, Sandy. I'm going to ask Vivian to go ahead and launch the last poll while we go on to ask you a little bit, Suzy. What are you seeing?
We're actually one of the providers that gets referrals for mental health services from the Coordinated Victims Assistance Center. We've been a longtime partner with them, and we generally get a high number of referrals, but we've been getting even more lately. What I find interesting is that it was challenging in the past to actually open the cases for many reasons, because many of the families need to go to shelters and there are many barriers to treatment. We're actually, through the pandemic, we've been able to open more cases for services, which I'm really happy about because there's such a need. And in terms of signs, and something we're also seeing more of lately are the teenagers actually being aggressive toward the parents. And then we're getting the cases for one of our evidence-based family therapy models in lieu of arrest. And there are years of trauma and challenges within the family with communication. And we've been able to really have an impact on those families where there is domestic violence either between the parents or between the children and the parents, or both. So we're definitely seeing an increase. And I think because the families are home and haven't gone to school, it's harder to bring it to light unless the victims are calling, and that has increased, which is great that they are calling for help. And we've had even situations where during the initial assessment that we do over telehealth, a mom being afraid to speak up because her husband's in the other room and he's been hitting her. So we're navigating those things as well to try to do everything we can to get help for the kids and for the parents.
Amazing. Yes, speak up, speak up. Dr. Tasha.
I have a little list. I'm thinking, number one, there are angry outbursts. Your normal personality and how you have become possibly even more reactive or impulsive. There's the crying spells where you're just like, I just don't know what's wrong with me. And so this level of heightened sensitivity, sometimes because you don't have much of an outlet. I wanted to say, when it comes to the heightened sensitivity, the D word is coming up, as in divorce in a lot of marriages or breakups. And this is something that we've been seeing for like probably the last 6 months since April. And that it's a lot of this time that is kind of, I don't know what we can say, that basically it's a lot of times that you are possibly as unhappy as you are now, is that you had been distracting yourself for possibly so many years or months, and that now you don't have as many distractions. Eating too much, okay, or not, you're not eating at all, meaning you have no appetite. Sleeping too much, or possibly not getting any sleep, even sleep disturbances. And someone talked about earlier how important it is to actually get those 8 hours. We always put kids to sleep by 9 or 10 p.m. to get up at 6 or 7. But like, guess who also needs 8 hours of sleep? That's you. Not being very productive. A lot of times we think that men just, they have their level of ego that goes along with productivity, but so do we. There's something very fulfilling when we're able to check things off the to-do list. Isolating more than you normally have in the past. Not getting out of the bed or getting dressed. I've been making lots of jokes about the sweatpants that you've been wearing from Monday through Thursday. That'll tell you a lot. And then lastly, worrying a lot more than normal. And sometimes that can even be generational, where a lot of times your mom worried, your grandma worried, and then you think it's actually normal and it's been normalized. But guess what? Worrying does not add another day to your life. It really doesn't.
Thank you so much. We only have like less than a minute left. So I'm going to go quickly. If you can, Vivi, just so we keep connected. Give Miami-Dade. You're going to be seeing email blasts from us. Please show your support. It's really essential. And we thank you for doing so. And we want to make sure that you come back here and you always include in that exit survey right in your inbox as soon as you're done, your feedback. So everybody who attends, you'll get it in your inbox as soon as you're done. It really is important. We're measuring and we're taking your input, and it's like gold to us, gold like that square behind our big W. So your information makes us powerful together. Our next Impact Collaborative is going to be another really interesting one, always the first Thursday of every month. This one's on our economic mobility pillar, and we're looking at a gender and family focus on affordable housing. And all these things are interdigitated. Your mental health makes a difference, you know, what your living situation is, et cetera. So we thank everybody so much for being with us. Thank you, Chrystine, for all of those resources you gave for the elderly. So I think we've got that covered. Thank each and every one of you for attending. This is your Women's Fund. Please keep collaborating. As soon as we leave this plaza, many of you are connected. We'll make sure that it keeps on happening, and we'll see you on December 3rd. Take good care of yourselves. Panelists, you're amazing.
Thank you. Thank you.
Thank you so much. I can't even begin to say, if you don't open your mouth and you don't talk about these things, if it doesn't get into the mainstream conversation, days go by and people don't take care of themselves and they don't reach out to you all.
Thank you so much for having us, for having me.
Definitely.
Yes,
thank
well
you.
organized. I loved it. Thank you. Nice meeting Dr. Patty, Sandy, and Suzy.
Meeting you all. Yeah,
Yes, nice
let's
meeting
stay
you.
in touch, right? Too bad we couldn't meet in person, but opportunities to collaborate.
I've met Dr. Patty and she was in one of our United Way presentations.
Yes, that's right.
See you.
Yes, that's
I'm
right.
happy to meet the rest of you.
Yeah.
Fantastic. Yeah. Exchange of resources. Well, thank you all so much, and we'll be in touch.
Thank you.
Thank you.
Thank
Have a great
you.
afternoon.
Bye.
Take care.